The 5 signs that make me suspect a patient who comes to my office might have a herniated disc are when they talk to me about their low back pain. If you're suffering from low back pain, you should know that the primary cause isn't always a herniated disc. So I want to talk about the 5 signs that do make me suspect a hernia in my patients. I also want to explain a small test you can do on your own for further confirmation and the easiest, simplest exercise you can do to decompress your lower back. The first sign that makes me suspect a herniated disc is pain irradiation. Irradiated pain is pain that starts in the lower back, its point of origin, and then travels down the leg following the path of a nerve. So if the hernia involves the last 2 discs, L4, L5, and L5S1, it will cause sciatica. This means the pain from the lower back will spread behind the glute, down the back of the leg, and to the side, all the way to the calf. If the hernia were higher up, at the level of the femoral nerve, we would be talking about femoral nerve pain, or cruralgia, which is pain that spreads from the lower back to the front of the thigh and the front of the leg. This phenomenon of irradiation tells us that the herniated disc is compressing the nerve root. It's happening in a specific area, the intervertebral foramen, where the nerve root passes through and then, as the name implies, forms the nerve. This is a very important symptom that shouldn't be underestimated. It gives us a clear indication that it's time to run some diagnostic tests. The second sign is pain that increases or appears when you bend forward. So the patient tells me that when they bend their torso forward, they feel a sharp stabbing pain, and this is because our spinal cord inside the spinal canal has a few millimeters of glide. It's able to slide up and down. If inside the spinal canal, where the spinal cord sits, there's an obstruction, meaning a hernia has entered the space, then this gliding motion will cause friction between the 2 surfaces, and the sensitive part will register it as pain. So it's a fairly clear sign of spinal cord compression. It's not specific only to a herniated disc, so further diagnostic tests will be needed. The third sign is pain accompanied by a muscle or sensitivity deficit. This is when a patient reports feeling a difference in muscle strength between their right and left sides, between the 2 legs, and even a certain amount of instability. Sometimes there's also altered sensitivity, so you might have an area that feels numb, almost anesthetized, or you could have heightened sensitivity, like a pins and needles feeling, or as if the area is burning or scalding. All are alterations in sensitivity. And this, of course, is another very important sign that shouldn't be ignored. It means the compression on the nerve roots is affecting not just the sensory part that causes pain, but has now also involved the muscles and your external sensory perception. So it's very, very important not to underestimate this. It also adds a sense of urgency. We need to run some tests because a decompression might be necessary, whether through physiotherapy, medication, or surgery. It's important to do this in a timely manner. The fourth sign of a possible herniated disc is the patient's inability to stand up from a chair without pushing off with their hands. This is very common. In more severe cases, we even see a lateral shift. When the patient tries to stand, they can't do it because their extensor muscles aren't strong enough. So their legs and back can't manage it on their own. They have to push up with their hands. Sometimes, as I mentioned, they shift to the side because they're trying to open up, decompress, and move away from the painful area. This is a very clear sign of compression, and it's certainly quite debilitating. So in this case too, it's necessary to intervene and get a diagnostic test done quickly. The fifth and final sign is pain that appears or worsens when you cough, sneeze, or have a bowel movement. Every time I ask a patient if they feel pain when they have a bowel movement, they tell me their intestines are fine, but that's not my objective. I ask the question because I want to know if when they strain that area, they feel a sharp pain in their back. It's important to know this because during these physiological movements, such as coughing or sneezing, the pressure inside the spinal canal increases. Therefore, if there's compression from a herniated disc, the patient will feel a sharp stab of pain. This is obviously a transient, very quick phenomenon, which is why patients tend to underestimate it. This is the sign that patients underestimate the most. In this case, too, we have a clear indication that there's pressure on the nerve structure and therefore a diagnostic test is needed. If you've recognized one or more of these signs in your own clinical situation, I strongly advise you to see a doctor, a neurosurgeon, neurologist, physiatrist, or orthopedist. They will then decide what further tests to run, such as an MRI, which is the best exam for studying our intervertebral discs, or an electromyography, for example, to understand how the nerve is functioning. In the meantime, if you'd like another indication, I recommend this test you can do at home by yourself. You sit on a chair, bring your chin to your sternum, and bring your shoulders toward your knees, bending your torso forward. From this position, straighten your legs, extending your knees with your feet flexed. If this position causes you pain in your lower back, it means there's compression at that level that could be generated by the disc, so by a herniated disc. If instead you feel pain in the back of your thighs, in that case you can be a bit more at ease. This means it's a peripheral issue, which could also be caused by stiffness in the nerve or in the hamstring muscles. You can use this decompression exercise, which is the easiest one of all you can do, a McKenzie type decompression. While standing with your hands on your hips, extend your spine, bringing your chin upward. You don't need to overdo the movement. Hold this position for a few seconds and then return to the starting position. Repeat it several times until you reach 5 to 10 minutes, and you can repeat it multiple times throughout the day. This is the simplest exercise you can possibly do. Let me know in the comments if you've tried the test, the exercise, and especially what you think of the video, if you liked it, if you got some additional and clearer information about lumbar herniated discs. As always, I'll leave the scientific and bibliographic references for what I've talked about in the video description. Thank you for watching the video, and I'll see you in the next one. See you soon.